Alright, so I'm going to be talking about Estim for edema due to immobility. And the reasons we would do this would be to reduce edema caused by a lack of movement. We would be reaching the motor stimulus, and this allows muscles to compress the veins and lymphatics so that there's improved fluid return to the heart. Some general contraindications would be any cardiac pacemakers, an implanted defibrillator, any unstable arrhythmias. You don't want to do Estim over the carotid sinus. And you also want to screen for deep vein thromboses because you don't want to do Estim over like venous or arterial thrombosis. And then you don't want to do Estim over the trunk if you're pregnant. Other contraindications specific for edema would be to make sure that the edema is not due to inflammation or organ failure, because in that case we wouldn't be doing this. Other precautions include cardiac disease, which we kind of mentioned before with contraindications. If there's impaired sensation or mentation, if there's any malignancies, and then also if there's any skin irritation or open wounds. So an example patient here could be a patient that has bilateral lower extremity edema due to prolonged bed rest, resulting in venous stasis, and there wouldn't be any cardiac or organ involvement here. So the parameters, it would be neuromuscular Estim using biphasic motor level stimulation, and we would be putting it on the gastroc if, say, there was lower extremity edema. So the pulse duration would be about 200 microseconds. The frequency would be 80 PPS. The intensity would be up until there's a muscle contraction. The on-off time would be a 1-to-1 ratio, and the total time we would do it for about 20 minutes. And during the treatment, we want to continually assess for burns, skin irritation, if the patient's in any pain. We would be asking them, and then we also want to assess that after the treatment is discontinued as well. So other treatments for edema due to lack of mobility would be things like compression devices or stockings, encouraging ambulation and movement, limb elevation, dietary management like decreasing salt intake, and things like that. And that's it.